City.
CPR is used in emergency situations to treat victims of sudden cardiac arrest, heart attacks, and stroke. But many people have not been able to master the complicated technique. So the American Heart Association recently updated its guidelines to make CPR easier to learn and more effective. Dr. Paul Pepe is the national spokesperson for the American Heart Association. Dr. Pepe, good morning.
Hey, good morning to you.
Why the change in the guidelines?
Well, we just want to make it simpler for people to use, and it is a simple technique. We just want to even make it more simpler to have people do it. I mean, if you look at it, it's clear-cut why we have to know CPR. And today, and under most circumstances, there's no way a professional rescuer can get to you in the 4 or 5 minutes in which permanent brain damage can occur if your loved one suddenly heart stops beating or they stop breathing from a lot of things, whether it's
so
choking,
you gotta know it
absolutely,
to save lives.
70 to 80% of the cases that require CPR occur in and around the home. Another 10 or 15% in the workplace. It's going to be someone you know or love. You're going to save. Everybody's got to know it.
All right, you brought a dummy here to show us what to do. The first thing that's changed is that you don't check for a pulse anymore.
Yeah, we used to do that, of course, because we thought that'd be a good thing to do, but it turns out it's a difficult thing for the average person to do, and it wastes valuable time. Time is critical. Seconds count in CPR. So what we're saying is just look for other signs of lifelessness, such as not breathing or responding to the care.
All right. Paramedic Philip Freed is here also to give us a bit of a demonstration. Show us what you've got here.
Yeah, we're very fortunate to have Philip here. He's the chief physician assistant from Lenox Hill Hospital. He basically is an expert in this area. And what we're going to do is first show what we do. We do chest compressions now at a rate of 15 for every 2 breaths. So if you don't mind,
so just stand up here.
Yeah.
All right, now you put your palm right where?
You can either look for the nipple lines, or they're still recommending the old method of going 2 fingers above where
the bottom of the rib cage.
Exactly. So in this case, I'm going to use the mid-nipple line on the sternum.
And you put your palm there.
Palm only, right here.
Okay.
Okay. And I'm going to put my palm down, keep my hands off the chest. I'm going to press about 1/2 to 2 inches down at a rate of 15 compressions.
15 compressions.
Yeah, we do it at a rate about what we say is 100%. What you need is just 1 and 2, and then give basically 2 breaths, okay, and then go back. The reason why we're moving to this for all cases is that the chest compressions are really the key thing that really provides circulation. You need to sustain that. We really need not to interrupt those chest compressions too often, but you need to get breaths.
You don't worry about pushing too hard, right?
No, at all. Think about it. This is a person who has no other chance of making unless you do the chest compressions. This is the best shot they have. So.
All right, so again, how many, and then how many breaths?
15 compressions.
15 compressions, and then
2 breaths.
2 breaths.
Yeah.
13, 14, 15. Head tilt, chin lift.
Head tilt is important so you can get the air actually through the airways.
You don't want the air going into the esophagus.
Right. Okay.
You want it going down the windpipe.
Now, you've also brought an external defibrillator,
Yeah.
which is sort of the wave of the future.
One of the cool things is that the Heart Association brought together 300 international scientists to make things easier. And one of the things that the technology has advanced so much that these things now anybody can use. We're even teaching school children how to use these
You're
things.
putting them in your car. They've got them on airplanes.
Absolutely. And I think in 10 years or so, they'll be so cheap and easy to use that anybody will be able to do it in their home.
And essentially just push the button and it gives you instructions.
Yeah, you probably never seen this, but go ahead, turn it on.
Pads go right here and here, just with the symbols. Please press the button for me.
Yeah.
The green
Push the button?
Yeah, it will tell you exactly what to do.
And there we go. All right.
Analyzing Hartman.
It'll talk to you.
Do not touch the
An automated doctor.
Exactly.
Gentlemen, thank you so much. Good information. Nice to see you.
All right, thank you.
7:52, we'll be right back.
shock advised.
For more on this topic and other health and medical stories, visit our website at cbs.healthwatch.com. CBS Health Watch, sponsored by Neosport.